when fertility journey starts late, right? The desire for a child comes, right? But time has already moved ahead. From the first episode, I'll say some things about biology will not wait for you. Biology will not wait for your career. Biology will not wait for your enjoyment, right? When you're ready. You know, that many people assume that fertility is always available whenever they are ready. Newsflash, you're wrong, right? You know, for some people, life is busy. Education comes first. Career goals will follow after education. Financial stability also matters, right? Emotional readiness takes time. The right partner may come later than expected. All these are all the things that we consider when we're talking about starting a family. When we talk about starting um, having kids. So because of all that, the newest mother in town is here. How is the beautiful daughter? All right, I was supposed to chat you up yesterday. I forgot. I was busy with many things, right? But I'll chat you up after the live stream. Is that okay? I will. All right. So if you are listening, the next congratulation will be yours. If you're trying to conceive, the next congratulation will be yours. So you want to stick to the live stream, listen to what we are teaching. So with all that, they say so the plan becomes we will start trying when everything is settled. That is what you are saying in your mind right now. That is what your neighbor said. That is what your family member said. Maybe your parents even advise you. And then one day, the trying to conceive begins. But pregnancy does not come as easily as expected. You know how many times I have to hear over and over again, oh, we'll be trying to conceive for 1 year, 2 years, 5 years, 10 years, 15 years. And it's just not happening. What's wrong? Right? You see, fertility journey often starts later than biology prefers. Right? Why? Because it's not you that would decide for biology. Biology will decide for you. And good enough, biology does not wait for you. The time just keep going. Right? So let's answer what's her name now? Christy LaBelle. Let's answer her question. What does starting late really mean? Who is ready to hear the answer to that question? It's a very intelligent question, right? Right? What does starting late really mean? What does it mean to start late? Am I already late? Am I making decisions that will make me to start late? Let's answer that question. Right? Now, from a biological standpoint, right, fertility does not follow social timelines like the ones I mentioned earlier. It doesn't follow. It follows aging of eggs and sperm. And that's why we'll bring you these details tonight so that you know where you stand in this biological timeline, not your social timeline, right? In fertility medicine, yeah, women under 30 are considered to be in the peak of their fertility window. Women under 30 at their peak, right? So what's the topic of today? So sorry, that's the topic is on the sticker. when starting your fertility journey late. That's the topic, right? So I was saying that in fertility medicine, women under 30 are considered in their peak of fertility window. Under 30. Under 30, just wave at me. Hi. I'm talking about you, right? So that's your peak. So it's not the time to start conceive and throw away, conceive and throw away. No, don't do that. Don't do that. You don't want to do that. Right? So women under 30 are their peak of the fertility window. And after 30, fertility begins to gradually decline. Right? Begin to decline gradually. Right? After 35, the decline becomes more noticeable. Yeah? So you want to get a pen and paper and put these timelines so that you put it in front of you every day. Right? After 35, the decline becomes more noticeable. After 40, the fertility drops sharply. I see some people 40 and above. Somebody, please, I want to ask a question and I want you to bring me up. Yes, I'll just stick around. We have a question and answer segment where you can ask all your questions and we will answer your questions. So for now, just learn something. More likely we'll answer your question before we are done, right? So just stick around. Listen, is that okay? So I see people in 40 and above, and sometimes I wonder, why is your doctor not telling you the truth? Why are they not brutally truthful to you? Are they afraid? Right? They shouldn't be afraid. They should tell you. And I'm going to give you some statistics tonight. I'll give you some statistics tonight. According to the ages, the percentage chances of conception, according to the ages. Percentage chances of IVF success, according to the ages. You don't want to miss those statistics so that you don't deceive yourself. What do I always say? The time to start having kids is today, not tomorrow. The time to go for the IVF is today, not tomorrow. If having kids is part of your plan, don't waste time. So don't start late. That's what we're trying to say. For men, because people always think that it's all about women. Women aspire. Oh, newsflash. This bullet touch men too, For men, fertility declines more slowly, right? But sperm quality also changes with age. And with that change in age, DNA fragmentation increases, especially after 40. 40 and above, DNA fragmentation increase. So when couples begin trying to conceive, right, at 35, 38, at 40 and above, they are starting the fertility journey with less biological margin for error. In other words, they are starting late. That is what starting late means, right? Because you have given lesser chance for biology to take its course. Stick around. I'm going to use some statistics that will shock you. So if you are there saying, we are married, we are waiting for 5 years so that we just enjoy our life, you want to go to Bahamas and not. So you cannot be pregnant and go to Bahamas. Is that what you are trying to tell me? Right? So why do people start late? Why? Why are you like this? Why do you start late? But from what I've noticed, the reasons are really careless. It's not that they are careless. No, it's not. These are things that they've thought of it. They've had a thoughtful discussion about it. They've taken responsibility about starting late. And it all sounds practical. You don't want to blame if you listen to why they want to start having kids late. It's practical. Yeah. And the common reasons, let me show you. Let me show you. Come on, man. If you are still there and you can hear me, please type in the comment section. I'm here so that let's get the interaction going. Right? Before I move to the common reasons why people start late. Right? Type in the comment section, I'm here. Let's talk about it. Common reasons. Please tap on your screen and share the live. People need this information tonight. And I want you to give them the opportunity by tapping on your screen. Right? So who is here? Just type in the comment section, I'm here. Let's see who and who we're talking to tonight. God's eye is here. All right. Now, if you're coming for the first time, you want to follow me. And join the live stream every Monday to Friday, 7:30 p.m. Nigerian time. God's eye, stick around. We'll deal with all those issues. I just need you to pay attention. More likely, the answer to your question is already here. So you want to exercise some patience. Is that okay? All right. So why do people, these are the common reasons why people start late, right? The first one, I told you, is practical. I told you it's thoughtful. The first one is education and career goals. That's very thoughtful. People delay trying to conceive because of education and career goals. Many individuals will spend their 20s in school. I'm in that boat too. Right? So many of us were in that boat. They spend their 20s in school. Right? They build professional stability in their early 30s and delay family planning until financial security is achieved. When will you achieve this financial security? Given the way that the more you try to make effort, the economy shifts against you. You make some more effort, the economy shifts against you. When are you going to achieve this financial goal? Oh boy, you got to be smart, Right? So, education and career goals is number one reason why people start late. What is the next reason? The other reason is late marriage or late partnership agreement, because I know some people don't want to get married. They just want to be in a partnership system of companionship. I don't know. Some people do not meet the right partner early, unfortunately. But I always say there's actually no right or wrong partner. It's just that person that is not good enough for you. Right? So that is a reason why people will delay starting to try. Right? Why people will start late. Thank you. Is that Pretty Gold is here? Hello, Pretty Gold. Good to see you. Such a long time. Good to see you. Thank you for the gifts. Right? Some people do not meet the right partner early, so they start trying late. It's not their fault. Just like the right partner is not. I would speak to some of my patients. I say, "What are you waiting for?" They say, "Where is the man?" And I'm like, "Come on, man. Go out on the street. There are men everywhere. So what are you asking me?" Right? So some people do not meet the right partner early. That's why they are starting late. Right? Some people experience relationship setback, like broken hearts. I think who sang that song? It is Celine Dion or something. Unbreak my heart. Right? So you that is heartbreaker, as you're looking at me, Please stop breaking hearts so that we can start trying early. Is that okay? Stop breaking hearts. Right? Stay one place. Let us do this thing together. Huh? Is that okay? Repent. God will touch you this night. Tony Braxton, thank you. Thank you very much, Tony Braxton. So you that is heartbreaker listening to me, Tony Braxton is talking to you tonight. Unbreak my heart. Right? Say you love me again. Let us start early. Pretty good evening, you're welcome. Right? Are you the one that wants to unbreak my heart? All right. Unbreak my heart. Right? Hello, Nana Ama, I see you. Right? So that we start early. Who is asking question that I want to forget? Write it down. Write it down somewhere. Write it down somewhere. And learn. It's important you learn. Right? So people start late because of late marriage and partnership arrangements. Like they do not meet the right partner early. They experience relationship setback. They marry later than expected. You know, even as a 6 years old boy, I've already envisaged that by the time by the time I get to 25 years, I should be married. But look at what life has done to me, right? So how can I start early? I can start early. Doctor, you don't notice the testimony that someone gave a testimony. Please bring up the testimony again, please. I didn't see it. I'm talking about heartbreak. Sorry. That's why I did not see it. Right, please give the testimony again, please. Like I didn't see it. All right. So many people, or rather, some people marry later than expected. Fertility timing is often tied to relationship timing. Why? Because for us, especially those of us in this side of the world, starting to have kids is equal to getting married. Right? So she said she has put to birth, and thanks to your advice, she's offline. Queen Joy, oh, congratulations! 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 God bless you. All right. If you are still here, you want to drop a message again. So let me pray my quota to that child. Is that okay? If you are still here, but if you are not here, God bless you. Right. So I was saying that fertility timing is always tied to relationship timing. Always tied to relationship timing. Number 3 reason why people start trying late, is financial planning. Right? Raising a child requires housing. You're not going to give birth to a child on the streets. So you got to have roof over your head. You have to make sure you have enough resources for the child's health care. You got to have enough resources for the child's education. You got to have enough stability. So it's not enough to just knock. Then the born pikin. And after the child is born, mama and papa, they are now arguing. Nobody's giving attention to the child because it's you, it's not you. We are fighting all over the place. No, you don't want to do that. Raising a child requires a lot. And when some people sit down to think about this thing, it's one of the reasons why they are starting late. They are thinking, if I start now, what happens? Do I have enough provision for my child? Right? So many couples will rather wait until they feel that they are financially ready. Right? Yes, there's a lot of There's a lot of according to you, narcology that has gone wrong, right? There's many things to say, but that is not my niche, so I'm not going to go there, right? Maybe when I come to any of your live stream, we'll talk about it, right? But please stop fighting. For the child should be more important than anything else, right? So financial planning is another reason why people start late. The next one, some people have that will be number 4, right? Some people have health or personal circumstances, right? Some delays are due to chronic illnesses. Some have chronic illnesses. And isn't it when you are sick, you are thinking of how you want to bring a child to this world? You have to take care of yourself first, right? Some delays are due to family responsibilities, especially those of us on this side of the world, the global south. What do? We want to make sure we build house in the village to impress our ancestors. We want to make sure we have we take care of everybody. Everybody's stable before there is another reason for delay. And some have previous trauma, right? Maybe due to some personal circumstances or health circumstances, right? And look at life generally these days, so unstable. So unstable. So starting late is often a life decision, not a careless one. So people give a serious thought to this thing. They say, oh, men don't want to marry these days. It's not true. It's not true. I can guarantee you that most men want to marry, but they are thinking, if I marry now, do I have enough resources to handle this new family? And that's what a responsible man should think. Not go and be planting seed to every woman that is ready to collect. And you have children all over the place and you're not contributing 1 naira to their upkeep. No, that's not good. That's not a good thing. Right? All right. If you are still here, please talk to me in the comment section. Just type I'm here. Let me be sure you're here. If you're just joining, you're welcome. If you're seeing me for the first time, make sure you're following me. And if you're trying to conceive, you want to make me your best friend, right? Because we got some good stuff for you, right? So let me give you some biological realities. You see, I always will be brutally truthful with all of you. You know why? Because if we're not truthful with you, keep on wasting time, and you so waste time and start blaming God that God does not like you. It's not true. You are the one acting out of ignorance. So let's look at some biological reality of women fertility. Let's start with women, right? Who's there? Who's there? Who's ready for this? Some biological reality. Oh, I tell you, what you're about to hear will blow your mind. Right? Some biological reality. Sunflower, I see you. Ajike Ade, I see you. A woman is born with all the eggs she will ever have. All the eggs she will ever have. And I've always said that women don't produce eggs like men produce sperm. Right? All the eggs your baby girl will ever ovulate or lose in this world, she was born with it from day one. Right? And now these are the figures. Right? I'm going to give you approximate numbers, not specific numbers, just approximate numbers. Yeah. At birth, about 1 to 2 million eggs is what your baby girl or you yourself came out with at birth. So at birth, the female has 1 to 2 million eggs. At puberty, you would have lost almost all of them is now remaining 300,000 to 500,000 eggs. Where did the rest go? That is biology for you. So you can see the quantum loss of number of eggs. Let's say you were born with 1 million eggs. Then at puberty, 300,000 is remaining. How many did you lose? 700,000. You just arrive at puberty, you've not even done anything. No, 700,000 eggs is gone. Is that not insane? Right? Good evening, Ekaite Joe. I see you. If you're just joining, you're welcome. If you're not following me yet, you want to follow me. And if you're trying to conceive, grab me by the legs, because I should be your best friend right now. Yes, I know that network is disturbing, but don't worry. If you miss any episode, go to YouTube, search my name, Dr. Godwin EMB. All the episodes, yesterday, the day before, all of them will be here, right? All of them will be there for you to watch, right? So you will not miss anything. But please try to pay attention now. So where was I? So I said at puberty, when a woman attains puberty, only 300 to 500,000 eggs are remaining. Living legend is here. I see you. Hope you had a great day. Right? At puberty, 300,000 to 500,000 is what is remaining. When the woman attained 30 years of age, about 100,000 eggs is what is left. Can you see the geometric cut down in the number of eggs? Women don't produce eggs. Remember, they are born with the total number they will ever have. So you keep cutting down, cutting down, cutting down, cutting down. Somebody bloody rush. Ekaite, your bloody rush. Calm down. I'm going to tell you. Right? If you're just joining, you're welcome. I see you. If you're not following, better follow now. Join the fan club. You don't know what you're missing. And by the way, the TTC League is about coming in April 1st. If you're trying to conceive, join that league. And if you have met all the criteria, tell me in the comment section. After the TTC League, it will be very difficult to access me. I'm telling you. Now I'm begging everybody, come and get it for free. Come and get it for free. You say no. Don't worry. I will have your time in time to come. So where was I? By age 30, only 100,000 eggs. Hi, Ivy. Good to see you. Right? By age 30, only 100,000 eggs. These are approximate numbers anyway. So it's just around that neighborhood. It can be less, it can be a little more. Is that okay? So by 30, you're dealing with 100,000 eggs. Then by the time you hit 40 years of age, anywhere from 10,000 eggs to 25,000 eggs is what is left. But it's not just about the quantity, right? It's not just about the quantity. It's also about the quality. Remember that egg quality begins to depreciate from 35. From 35. This information, have it at the back of your mind, because you are going to need it when you are trying to make decision, whether through natural conception or through IVF. These are not the things they will sit you down to tell you in details. When I'm telling you in details, that's why some of you keep on going in cycles, wasting money, and I don't know why they're not telling you the truth. Anyway, if you don't take it for free here, you're going to pay for it later, right? All right, let's look at egg quality and age. Who is still here? Please type in the comment section, I'm here. Let me be sure you're still here. I know the network is just doing like this, but we'll be fine. Who is still here? Let's talk about egg quality and age. Great. As age increases, right, chromosomal abnormality increase with it. As age increases, chromosomal abnormality increase with it. Miscarriage risk increase with age. As you're getting older, in fact, from 35 years, you just notice that miscarriage it seems to happen more in people in that category than those that are lesser of age, right? Miscarriage risk increase. Fertilization rate declines. The rate at which you can be pregnant declines. Why are you not pregnant? Design. That is the question we're answering. So you want to stick around. Right? Fertilization rates decrease with age. You that even you when you are walking on those days when you're very young and small and cheeky, you're walking on the street, a guy just passes you and the breeze blow you like this, you become pregnant. Right? This you now is looking for pregnancy like crude oil. Is that not ridiculous? The reason is because as you grow older, the possibility of conception declines. So you have to try even harder or even assisted before you can achieve that result. And even when fertilization occurs, the embryo quality decreases. In other words, now you're older, egg quality is poor. You marry an older person, sperm quality poor. Fertilize, embryo quality poor. And the body has a quality control system that will take out poor quality embryo. So, see, statistics have even shown that the chances of natural, let's deal with natural, not those who even have issues. The chances of natural conception per cycle. Listen, you are getting enough information for you to make your decisions. Yeah? The chances of natural conception per cycle at age 25, you have 25 to 30% chance of conception. You are trying per cycle. The chance that this cycle you are going to get pregnant is 25% chance. So you got to know what you're doing. At 35, the chances of getting pregnant in this cycle per cycle is 15 to 20%. Normal individuals, healthy individuals I'm talking about. I'm not talking about those that already have issues. I'm talking about normal healthy individuals. You see how slim the chances are. Right? At 40, the chances of natural conception at 40 is about 5 to 10%. But if I'm that guy that is looking for money and you are coming, say, oh, I want to get pregnant, I'll just keep posting you. Go and do this test, go and do this test, go and do this. You just keep wasting money. God will help you. You need somebody that will tell you the truth, right? So that you will not be wasting money. And that's the part that gets to me more often than not. Somebody is clearly having almost zero chance of conception. You still give that person hope. Give them drugs. Say, take this. Just tell them to go for surrogacy. All right. At 40, I said the chances are about 5 to 10%. What about from 43 years and above? What are the chances? Should I break your heart? No, I will not break your heart because I already sang on "Break My Heart" by Tony Braxton, right? So I will not break your heart. But this is the truth. At 35 years and above, the chances of natural conception is less than 5%. It's less than 5%. So more likely you need intervention, right? Be smart. Be reproductively smart. Is that okay? What about Thank you very much. Thank you. What about miscarriage risk by the age? What are the risk of miscarriage according to age? Who is ready for this gist? Risk of miscarriage according to age. Who is ready? Talk to me. Just type ready. Thank you very much, Ivy. Who's ready? Type ready in the comment section. Yeah. Miscarriage risk by the age. Under 35 years, the miscarriage risk at that age is about 10%. So out of 100, more likely 10 people under the age of 30 may have miscarriage. At 35, the percentage risk of miscarriage is about 20%. You see, is now increasing for obvious reasons, which we have talked about. For obvious reasons. So please, if you see Amo Love, you want to go to my YouTube channel, Dr. Godwin EMB, all the previous episodes of the live stream, including yesterday's Zoom, they are there now. So you want to follow them. You understand why these things happen. But stick around. I'm still going to tell you. Yes, it's age, but there's the reason why it happens, right? So stick around. Learn today's Zoom first. Then you go to YouTube, type Dr. Godwin EMB. You see all the previous. If you are trying to conceive, that channel should be your. Just sit with it. Follow it episode by episode. You are going to learn too much. In fact, if you don't want to get pregnant, don't watch my videos on YouTube. Because if you watch it long and hard enough, you go carry belly. I tell you. You will. Certainly you will. Now, the miscarriage risk at age 40 is about 35 to 40%. So you see, there's more risk of miscarriage when you are above 35 than when you are in your 20s. Why? Because egg quality begins to decline from 35 and above. Of course, even quantity crashes, right? Even quantity crashes. Now, what about at 45? At 45, miscarriage risk is over 50%. So, more likely if you conceive 5 times, or rather 10 times, 5 of that pregnancy will be lost in. So, doctor, I don't know. My village people, they are at me. I dream that. Calm down. Understand the biology first, so that when you want to pray, you know what to pray about. Is that okay? All these risk is mostly due to chromosomal abnormalities in the egg. Poor quality egg. So when is the time for you to start trying to get pregnant? Today. Go and marry. Right? Go and marry. We have sang "Unbreak My Heart." So now your heart is unbroken. By the time you leave this live stream, please check what? Pretty lady, check what? Go ahead. Let me say it again. I don't understand. Right? So, I was saying, this miscarriage risk is mostly due to chromosomal abnormalities in the egg. How old are you? You have chances depend on your age, right? And several other things. Now, who is ready to hear about the male factor? Let's talk about the male factor. Nobody talks about the male factor. Let's talk about the male factor, right? Let's talk about the male factor. I know some people will just go and say, hey, let us hear this thing now. Let us hear. All right, male factor. So you are a guy, position and listen. And if the men are not here, maybe they're watching football somewhere, please listen for them so you can now educate your partner. Because this journey is teamwork. You, your partner, and your doctor. If you're just joining, you're welcome. Let's talk about the male factor. Thank you for the follow, I see you. Now, male fertility is often overlooked for obvious reasons, cultural reasons, basically. Right? It's often overlooked. But this is what the research have shown. Research have shown that after 40 years, justice for 40 years and above, I beg, God help. So research have shown that after age 40 for men, please tap on your screen, it's very important for us right now. Right, tap on your screen, thank you. After age 40 for men, sperm motility may decline. What does that mean? Motility means movement, the ability for sperm to move. And remember, the tendency of sperm is to move forward, not just to be moving all over the place. Move forward. So that movement declines at age 40. You that any woman you catch like this, she must carry. Now, you don't catch up to 10, nobody carry. Why? Because age is beginning to tell. Right? Age is beginning to tell. Sperm motility declines from 40. Right? DNA fragmentation increases. And of course, that determines the quality of the sperm anyway. So sperm quality declines from 42. Right? And time to impregnate your partner or whoever becomes longer. No, think about it. You want to pause and think. Is it not this you that you are even running away? Somebody just came to visit you. Something happened. The next week she's calling you. I don't carry. But now you knock. You never hear say anybody carry belle. You wonder why? What is happening? Nothing is happening. It's age. It's age. Why? Because this is, thank you very much. I appreciate you. Because as age for men, especially 40 and above, the time to impregnate a woman becomes longer. You keep on trying and trying. Right? So older paternal age, the older a man gets, the older age men gets, it has been linked with increased risk of, can I shock you now? As men grow older, the studies have shown that there is increased risk of autism for if the child ever comes. If your knacking becomes successful, if there's increased risk of autism. If your knacking becomes successful, there's increased risk of some genetic conditions. You say, why is this baby like this? See, I'm telling you, the time to start having kids is now. So if you miss the earlier things I said, don't worry, go to YouTube. You hear the things I said and you appreciate what I'm saying now. Why? Because as men grow older, sperm quality depreciates. Therefore, embryo quality will be poor. Now, sperm quality is poor. The woman is older. Egg quality is poor. They fertilize, and everything is just poor. More likely, there's going to be. Hi, is that Antonio? I see you, Antonio. You're welcome. So I said all this to say fertility is not all about the woman's age. The man's age also matter, right? The man's age also matter. So while we are looking at the woman with corner eye, we should be looking at the man with straight eyeballs. Is that okay? I'm saying is here. You're welcome. We should be looking at the man with straight eyeballs. Right? So if you're just joining, you're welcome. We're talking about when you start fertility journey late. That's what we're talking about. Right? And if you've missed anything, don't worry. Go to YouTube. All the episodes you missed are there. Dr. Godwin EMB is the name. Make sure you subscribe. Help us grow there so that we can reach more people. All right. Now, after saying all this, do you also know that all that limitations of starting late and the attendant troubles that come with it have emotional reality? And what are the emotional reality? Couples who start late often will feel the urgency. I want to. And is this urgency that's causing this fight, the quarrel every time? They feel pressured, maybe by family members, maybe by society, maybe by peers, right? A woman came to me a few days ago. She said, people have started looking at her tummy because she just got married. People have started looking at her tummy. So that is pressure. You feel pressure. Now, can this thing happen? Quick. The fear of running out of time is there. And the regret about earlier delays. So if we had known, we would have started this thing since. What I always tell you, don't put regret ahead of you. What is past is past. Today's solution is what we're looking for. Today. What is today's solution? And that's why I'm here. Right? That's why I'm here. So, as you already know, when you start late, there's less room for trial and error. Less room for trial and error. Now, those of you asking questions, we'll have a question and answer segment shortly, right? We'll answer your questions. And if you also don't want to ask your question publicly, you can have a private consultation with me. And it costs nothing. If you're in Nigeria, it's 5K. Whatever 5K is in US, America, wherever, that's the same thing. But it's not for the money, it's just to help you, right? So let's do this. So I said there's less room for trial and error. There's less room for long waiting periods. We don't have that kind of time. And what do I always say? The time to start trying is today. And many of you are trying wrongly. That's why you need me in your life. I'm going to teach you how to try correctly. Right? I'm going to teach you. We will teach you how to try. As a couple, work together. No infighting. Is that okay? So, and if you start early, if you start trying early and you go for evaluation early, the chances are that if there is a problem, treatment options are many. But when you start late, you have cut down your treatment options. That's why some people, you talk to them and you give them the brutal truth. Say, come, what is remaining for you now is surrogacy. You say, I don't want it. But that is the only option. You waited too long. Don't start late. Start early. Is that okay? Start early. Thank you very much for the gift. Thank you. I appreciate you. Right? Because when it comes to trying, time becomes more valuable than anything else. Time. You don't have the time. You don't have the luxury of time when it comes to fertility. Even if you are 20 years old, you don't have the luxury of time. Is that okay? Thank you, MSEG, for the gifts. Thank you. Now let's answer one important question. Who is ready for this next question? How long should late starters, if you're a late starter, let me see your hand like this. How long should late starters try naturally? You say you want natural conception. Good, I'm with you. But how long should late starters try naturally? Who is ready? If you are ready for that, just type ready in the comment section. Thank you, MSEG, for the gifts. I appreciate you. If you are ready for this question, type ready in the comment section. How long should late starters try naturally? Nobody's ready. Nobody's here. Wonderful. Are you serious? All right, we'll just record it and drop it in YouTube. All right, Jimmy, I see you. How long should late starters try? You, that is a late starter. How long should you try? And as usual, we're going to look at it according to the ages. Is that okay? Is that okay? There's so much expose I'm giving you tonight. Why? Because it's important you know where you stand. It doesn't matter where you are in the world. Biology is the same everywhere, right? Unless there is something in your village people, you never said to them, right? So late starters, this is for you. If you're under age 35, your natural trying is for 12 months. Natural trying is for 12 months. You try for 12 months. Now, this is what trying will mean. It means that you are having unprotected sex. You are having sex 3 times a week for 12 months. And conception did not happen. Please go and get evaluated. Don't wait beyond that time. Is that okay? That is for those under 35. Right? For those around age 35 to 39, right? Age 35 to 39, your trying for natural conception should be anywhere around 6 months. You don't have the luxury of time, right? 6 months. Good, I see you, funny. 35 to 39, 6 months. You are trying for 6 months natural. Beyond 6 months, go and get evaluated. You don't have the luxury of time. Get evaluated, and if there is need for any treatment, go for it. Because you're wasting time. Yeah? Now for those 40 and above, 40 and above, and this is the age that I get usually offended at why some of you are not being told the brutal truth, right? So 40 and above, you want to seek fertility evaluation immediately. There's no time for you to start trying anything. You want to seek fertility evaluation. And if there's any treatment that needs to be done, get it. Don't be there saying you are trying and you're wasting time. And the more time you waste, you are cutting down your treatment options until there's no more option. I get offended when I speak to people and I ask myself, why are they not telling you the truth? Anyway, that's why you're hearing this today. Is that okay? All these, according to the ages I just mentioned, is not because pregnancy is impossible. No, it's not because pregnancy is impossible. It's actually because time is limited and early action will preserve your options. And that's what I'm all about. You want to take early actions. You want to be quick. Make sure you make up your mind on time so that even when there is need for treatment, you have multiple options to choose from. But the more you delay, the more you're cutting down the options. You don't have when it comes to biology, you don't have the luxury of time. You don't have the luxury of time. Please watch this video from the beginning. Go to YouTube, Dr. Godwin EMB. Watch the video from the beginning. There are some things I said that those of you that are just coming, you missed. And also, please subscribe there. Is that okay? So you don't have the luxury of time. Let's go to the next thing. The common mistakes when you are starting late. You're already starting late, but you are making mistakes. Double trouble, right? that is serious. You're already starting late, but you are starting with mistakes. So let's look at common mistakes. Who is here? Who is ready for common mistakes? Common mistakes. Who ready to hear the common mistakes that people who start late make? Yeah. Many couples who begin trying later will still follow the advice that is meant for younger couples. Why are you like this? It is not one peg fits all. This fertility journey is not one peg fits all. You're already starting late and you're an older couple, but you're seeking advice or receiving advice that is meant for younger couples. You're not doing yourself any favor. You are not doing yourself any favor because it's not gonna apply to you. So we are talking about the common. You cannot be an old and you're taking advice of younger couples. Sorry, you can't do that. Right? So these are the common mistakes. Let me list them out. If you're writing, you have to be writing. Or if you're not writing, no problem. Go to YouTube, search my name there, you'll see it. So the common mistake include waiting too long before testing. Right? Maybe for some reason you got married in your 40s. I say, oh look, let's try. You don't have that kind of time. Trying what? Right? It can happen naturally, but you need to get evaluated so that you know where you stand early. Right? Because some couples will try for 2 to 3 years before seeking help. You're a late starter already. But now you're still waiting for 2 to 3 years. And some others will assume it will happen naturally. Even me, I assume, right? They assume it happens naturally, eventually. Now, this can significantly reduce your treatment success. It can. Another common mistake is ignoring the male testing. Why is it that the man is usually the last person to be tested? How did you come about that understanding? No, it's wrong. Right? So ignoring the male testing, some test last or even not test at all. Simply because they must have said that, I used to have baby before. So I don't need to test because I'm all right. You are not all right. You're not all right. You're not all right. That's why in March, who has seen the flyer? In March, I have 30 days dissecting the male factor. Everything about male fertility, will bring it out and naked it so that both men and women will understand where they stand and how this thing functions. So in coming March, we may start much earlier though, but 30 days, we're going to talk about male factor. So you don't want to miss it. Invite all the men you know, young men, middle-aged men, old men, married, unmarried, those trying to conceive, and those running away from conception. Right? You want them to join so that they understand something. Right? Yes, men never accept that they have issues. How would they? When ego will not allow them. Right? They won't. But 30 days, I'm going to be talking about men. Only men in the month of March. So invite them. The live stream is for men. Okay, women should come too because it's important, right? It's important. So we're talking about ignoring male testing. Don't ignore male testing. The focus is often only on the woman. Why male fertility may also decline. I've talked about that earlier. It declines. And when you combine age effects of the man plus age effect of the woman, it becomes worse. See, be guided. Understand where you are in your fertility journey. Right? And anybody who is deceiving you just to collect your money, God will punish that person because they need to tell you the truth. I'm telling you, God will punish that person. Somebody told me he has drunk all the known supplements in this world. Nothing has happened. Achievers Tea is here. All the known supplements. Why? Because don't worry. Just listen to what I say. Is that okay? Now, the third mistake late starters make is the over-reliance on natural method. Right? You rely on natural method. There's nothing wrong in natural method. But do you see the statistics I gave? Do you see the timeline I gave according to ages? You want to be smart. Over-reliance on natural method. Late starters will sometimes rely only on calendar tracking, only on ovulation apps, on herbal remedies. Don't over rely on natural method. Be smart, right? Because I tell you that without proper evaluation, valuable time will be lost. And remember, as you lose such time, your options of treatment also reduces. So what you would have spent little for, you're spending more. What you would have spent shorter time to get, you're spending more time to get. That's why you need to be smart. Be reproductively smart. Right? That's the advice. It is very good evening, Mansere, Esther. I see you. You're welcome. Right? Starting late does not mean that you have failed. Doesn't mean you are a failure. There is advantage anyway of early action, but starting late doesn't mean that you failed. It only means that the strategy you are using next should be different, and that's where I come in. Rerouting the strategy. so that we can look at what you have done, then advise you on the next course of action to help. Good evening. Where have you been, Olami Posi? Where have you been? Good to see you. I know that those who already became pregnant, their belly don't heavy. They left the live stream. They don't come online anymore. So if you're in that category, good for you. All right. But there are some faces I've not seen for a long time. I hope you are good anyway. All right. So I'm saying instead of instead of long waiting period, instead of you can ask a question. I'm about to round off. You can ask a question, so just hold on, right? Instead of waiting for long, instead of guesswork, instead of casually trying, please, late starters, this will benefit you. Go for early fertility testing. You need precise ovulation tracking. In my earlier episode, I talked about ovulation tracking, but I'll still talk about it again, right? Please also consider timely medical intervention, right? Listen to your doctor. Let them advise you on the right course of action, right? And you should be able to have a clear treatment plan. And that's why we have the TTC League. Because the purpose of TTC League is to have a clear course of action, treatment plan, and clarity in everything. That's why I need you to join the TTC League. Don't snooze on this one. If you do, and by the way, nobody has actually contacted me that they want to join the TCC League. All right. Now that you don't need to do much, you are not taking advantage. The story will change pretty soon. Where are we? I was talking about what you should do, what will benefit you. You have a clear treatment plan. Charming luxury, I see. Right? Now, when you have a clear treatment plan, let's look at treatment outcomes by age. Now you've gone for treatment. What are the outcomes? What is the percentage success rate by the ages? Right? Right. Treatment outcome by age. Approximately, we should be looking at the IVF success rate per cycle, right? That's basically what I want to talk about. So those of you that are going for IVF, you know you want to know at my age what's the percentage success. What to do if you have tubal blockage? Go for IVF. Of course, there is hydrotubation, and your doctor can advise you. But I think just go for IVF. Let them bypass the blockage. Carry your baby, and you're happy. Well, that's my own opinion. Anybody else can have their own opinion. Is that okay? All right. Let's talk about approximate IVF success rate per cycle. Who's ready? Just type ready in the comment section. Let me see you. Who's ready? Who's ready? Ready. Under 35 years of age, IVF success rate is about 40 to 50%. And that is why, just a quick advice. Those of you that are going for IVF treatment, right? One of the things you want to do your background check on your fertility clinic to see their success rate. Because what makes a fertility facility tick is the success rate, right? When you see a fertility clinic with a high success rate, and you see another one with low success rate, where would you rather go? You want to go for the one with high success rates. And that is why very soon, we're going to be helping out those in Nigeria, those around Africa. Sorry, not yet. We'll start in Nigeria. We're going to have one or two quality fertility clinics that we can refer you to, that we are sure that if you go there, they'll do all the right things. Right? So we are doing a lot for you. You also do a lot for us. Right? We are doing a lot for you, do a lot for us. So that everywhere goes to you. Is that okay? All right, where was I? So I said under 35 going for IVF, you have 40 to 50% chance success rate. Right? Age 35 to 37, success rate is anywhere around 30 to 40% success rate. Age 38 to 40, IVF success rate is anywhere around 20 to 25%. Your own egg per cycle. Right? Age 41 to 42, IVF success rate 10 to 15%. Right? Now, these numbers or percentage actually will vary from clinic to clinic. It will also vary from individual to individual. But there is this consistent trend worldwide, and that's why I'm giving you a more robust statistics, which is actually global statistics. Is that okay? So it will vary from clinic to clinic and also vary from individual to individual. Is that okay? So I hope that is clear. Now, before I begin allowing us to ask questions, let's look at one or two more things, right? One or two more things. I hope you know. Good evening, Blessing TV. I see you. I hope you know that many couples who start late still conceive. So it's not like all is lost. No, all is not lost. Right? All is not lost. Many couples who start late still conceive. And the success here is more likely. Listen and understand. The success here is more likely when fertility evaluation is done early. Check that box. When treatment begins promptly. Check the next box. When the egg reserve is still reasonable. Egg reserve is when you do AMH, right? It's still reasonable. Check that box. When there is no major uterine or tubal problem. Your tubes are not blocked. There is no fibroid or abnormality. So you can still conceive without any problem, right? If all these criteria, you can successfully conceive if all these criteria are within the limits. Even after 40, pregnancy is still possible. But the path often requires more planning. Is that UK, my friend? How are you? Right? The path for the possibility of those after 40 will require more planning, more medical support. Loveline is here. Hello, Loveline. How is your day? So, more planning, more medical support, and faster decision. Stop wasting time. And I'm telling you, that's why this year we're going to be pushing some of you, push you until until you carry, right? It will push you. You cannot wait for you to be procrastinating. You're wasting time, right? You're wasting time. Good evening, Lady C. I see you. You're welcome. Right? Now, something important that you may not hear everywhere, right? Let's look at fertility preservation. Fertility preservation. You know that for individuals that are not ready for children yet, maybe this will serve as some wisdom to some of these young people, right? Right? For those who are not ready yet for children, modern medicine have actually offered options like egg freezing. Now, be smart. Be what? Be smart. Egg freezing. If you have a question, you want to hold on to your question, I'll answer it. You did not answer my own greeting. Who is this? Becca. Becca 3. Okay, I answer you now. Welcome in. You're welcome in. So as I'm talking, I basically sometimes don't read what's going on, but I see you now. You're welcome. So I'm talking about those who are attempting to delay conception. You say, no, I don't want to have children now. I want to wait. Let me enjoy my life. This is wisdom to you. Consider egg freezing. And egg freezing is best done. It's not anytime you just, okay, I want to go and freeze my egg. No, there's specific time that you should do that. Egg freezing is best done before 35 years. You want to freeze your egg? Before 35 years. 212 La Vida. How are you? Do I have a good news? 212 La Vida. Do I have a good news? Better drop the news. Drop the news. I want to hear the news. Right? So egg freezing is best done before 35 years of age. So you want to enjoy your life. You are tired of bed rest. When are we doing the pregnancy test? That's what I want to hear. Not you are complaining. No negative energy. I don't like that. I don't like that. You don't invest me like this. You don't invest me like this. I don't like negative energy. If you are tired, look for something to engage you. Is that okay? Thank you, lovely. All right. I'm waiting for good news, and you're telling me you are tired. So all this is for nothing? Come on, man. That's not nice. Right? So I will carry Oraimo code now because you will understand. All right. So where are we? So I was saying that egg freezing is best done before 35 years of age. Ideally before 38. So you have more than enough time to make that decision. Thank you, Mary J. I appreciate you. Why is this time? Because this preserves younger eggs for future use. The younger the egg, the better the quality. And if you freeze it early, you are freezing a quality egg that will give you a better result tomorrow. If you freeze it late, poor quality egg, poor result, more likely failure tomorrow. So be smart. That's for egg freezing. Sperm freezing is useful for men that are delaying fatherhood. Right? They just want the knock. They don't want to become father yet. So they're going to be freezing. So I'm talking about sperm freezing. Sperm freezing is useful for men who delay fatherhood. They just want the knock. They don't want to become father. This is for them. Go and tell them. It's also useful for men that are undergoing medical treatment. Some people have some conditions, right? They have some conditions. Maybe they are going through radiotherapy, right? So it's important to preserve the sperm, because if they go through it and come out, they may not even have the sperm available, right? So because of the condition, they freeze, right? And sperm freezing is also good for those with declining sperm parameters, right? When we do your evaluation, we see your sperm parameter is declining. So we advise you, guy, so that the future no go bleak. You want to check. Some men are sterile. Do you know? Some men are sterile. So that is egg freezing and sperm freezing. I just want to make sure I put it out there so that you are not confused, right? But this is the most important information about starting late. All the late comers, I mean, people who are starting late with respect to having kids, right? Starting late is not a mistake. I know why some of you want to start late. I know it's not a mistake, but it requires a different mindset. It requires knowledge. It requires um, exposure, right? And that's what we are doing today. Awareness, right? It requires a different mindset. Instead of let's just try and see what happens. That's a bad mindset. The better approach is, let's understand our fertility and act wisely. That is the best way to think. Is that okay? That's the best way to think. I want to ask those of you that are late starters, for whatever reason you want to start late. I want to ask you this question. Are you hoping time will cooperate with you? Is that what you're hoping? Or you are making decision that is based on biology? Where do you stand? You want to start late because, oh, don't worry, it will happen when it will happen. Or you are making a biology decision from what you have learned. That's why I'm teaching you this, so that you make informed decision that will not affect you in the future. Is that okay? If you are seeing me for the first time, you want to follow me, and if you are trying to conceive, you want to be my best friend, right? I said that to say hope is important. Hope is important, but biology sets the limits. Biology will not wait for you. Biology does not go by your emotions or your career plans. Today is the time to decide to start. Whether you want to do IVF, today is the time. You want to go natural, today is the time. Start early. Before I begin to take questions, I want to leave you with this, and this will also help for those latecomers who did not hear anything. Make sure you go to YouTube and search my name. You'll see the full video there so that you learn, right? I want to leave you with this. When the fertility journey starts late, time becomes more valuable. There's reason for that. Time becomes more valuable. Decisions become more strategic. And those of you who have consulted with, that you're supposed to give me feedback, I wonder what you are waiting for. You have the whole month for me to work with you. If you are my subscriber, the whole month I have to work with you. Don't waste your... Anyway, you're subscribing. That's why. But from when the TTC league starts, we're going to increase consultation, because people don't like cheap things. So let's go expensive. right? Time becomes more valuable. Decisions becomes more strategic. Early evaluation becomes essential. Starting late would not remove your chances, but it does change the path and options. Do you understand? So I hope you make the right decision after today.